Imagine a patient comes in for a brain tumor scan, but due to cost or time constraints, only 1 or 2 MRI sequences are taken instead of the full 4. So most deep learning models just break. Today we are looking at a paper that elegantly solves this by teaching a model to hallucinate the missing scans. So as a result here, hallucination is not a bug, it's a feature. Brain tumor diagnosis typically relies on 4 MRI modalities: T1, contrast enhanced T1, T2 and flare. Each one highlights different tissue. Miss one and your segmentation accuracy can drop from 82% dice all the way down to 45%. The challenge isn't just filling the gaps. You need a single unified model that handles any combination of missing modalities, not a separate model trained for every possible input-output pair which would explode combinatorially. The key insight of this paper is two fundamentally different types of information live in multimodal MRI. The first is intermodality correlation, the relationship between modalities at the same spatial location. If T1 looks a certain way at a voxel, what would T2 look like there? This is a sequential relationship across modalities. The second is intra-modality semantics, the local structure and texture within a single modality image. Tumors have edges, gradients, and spatial patterns. These two types of information call for two different architectural choices, which is exactly why the authors use a dual branch encoder. So, the sequential branch uses a vanilla vision transformer with absolute position embedding. Here's the intuition. You are treating the 4 modalities almost like words in a sentence. At each spatial patch location, you have a token from each modality. The VIT's global attention naturally asks, across these 4 modality tokens at this location, what patterns predict the missing one? It's sequence modeling over modality space, not spatial space. Global attention is exactly what you want. Every modality token should be able to attend to every other. The spatial branch uses a swing transformer with relative position embeddings. Here the job is different. You are modeling the local texture and anatomy within a single modality image. Swin's shifted window attention is computationally efficient for this because local spatial features are hierarchical, edges at fine scale, structures at coarse scale. Relative position embeddings also make more sense here because what matters here is things that are relative to each other, not their absolute position in the image grid. After both branches encode their features at each stage, the fusion block combines them. First, the features are simply added together. Then they are passed to a spatial attention model followed by a channel attention module using an MLP over maxed pool features. The result is a fused representation that knows both what the missing modality should look like locally and how it relates to its sibling modalities globally.